going to go ahead and get started with our SHAC meeting. Actually, this is our last SHAC meeting for the school year. So I want to thank everyone who have supported and served on the SHAC committee. I thank you all for your dedication to our SHAC meeting, to our SHAC council. And I know our president, she's not able to be here. She had a double booking, so her job sent her out of town, so she wasn't able to be here today. And she wanted me to tell you all hello, and she missed being in here with us today. Our agenda is as follows. The meeting has been called to order. We'll have the review of minutes. I'll review the minutes because I don't see our secretary here yet, so I'll go through the minutes. And then we have an employee wellness update, health screenings update, middle school health curriculum, Project Code Red update, and then the meeting will be adjourned. Our Project Code Red, those students was not going to be able to be here either because they had another engagement this afternoon. But she did send me her presentation, so I'll present that for her on their behalf. So our minutes, our last meeting was February 11th, 2026. The meeting was called to order at 4:35 p.m. Then we had mental health supports. That presenter was Ms. McIntosh Lee. Then we also went over our second semester attendance updates. And our secretary is walking in now, but I'll continue. We went over our second semester attendance updates. We had the drug, alcohol, and bullying prevention efforts. And that was a group activity and a group discussion that was done with that. And then our announcements made, which we still have the same announcement. We need more parents and more student representation on our SHAC committee. So I know, as I said, this is the last one for this school year. However, if you know of parents, if you know of students that would like to serve on SHAC, I encourage you to have them to reach out to me via email so that we can get them signed up for our upcoming school year. Okay, do we have any corrections or anything need to be made with the minutes? Our minutes are approved. Okay, thank you. All right, and this next update, myself and Ms. Wavers was going to present. However, Ms. Wavers is not here, so I will continue. So our employee fall wellness campaign, we did a ripple effect, which encouraged everyone to stay hydrated. So the benefits of staying hydrated, it helps with concentration, helps with memory and alertness. It reduces fatigue and brain fog. It keeps the blood circulating properly. It supports a healthy blood pressure, prevents dehydration-related tiredness. And then the simple tips to stay hydrated would be drinking water throughout the day. If you have a water bottle or a water container and you fill it up and you just take sips on it, you will be surprised at how much water you will intake in a day. So increasing the intake, also increasing your water intake during activity or when it's hot outside, you definitely need to drink more water and have eat water-rich foods, which includes fruits and vegetables. And those that participated in that incentive, they received a water bottle that had ripple effect on it. Then we also did a breast cancer awareness in October with Methodist. We partnered with Methodist and they came and did mammograms for those that signed up. And of course, there's a lot of reasons behind early detection. When you think about breast cancer, you know, the regular mammograms detect cancer early. The early diagnosis significantly increases your survival rate. And many people diagnosed with breast cancer, they don't have it in their family. So when they get those mammograms and those tests done, the earlier they get them done, and if it's detected, the treatment will start and the better it is for survival. We also during the spring had the spring nature walks where it was encouraging everyone to go out and enjoy the nature, thrive, walking outside, getting fresh air, taking just a few minutes out of a day, sometimes just stepping away from your work, maybe 5 minutes, going outside, getting some fresh air. It does you good, it clears your mind, and just helps you to focus that much more. Then in February, we did the Go Red and supported Ladies in Red. We spread the word by wearing red. Why does it matter? It raises awareness, saves lives through education, promotes healthy lifestyle changes, and it advocates for prevention. And also for the employees, we've had Mental Health Mondays, and that prevents educator burnout, and it also helps educators to motivates them to do self-care. Sometimes as educators, we take care of everyone else and we forget about taking care of ourselves. So the Mental Health Mondays was different seminars that they offered. The last one they had game night, and so we encourage our employees to participate in the Mental Health Mondays, which is supported through our counseling department. Last but not least, this spring we had a Panther Slim Down Showdown kickoff, and that's where we encouraged our staff members to compete to see who would lose the most weight. Each campus was encouraged to participate. Even departments, we had people at the plaza that participated in it. The average amount of weight lost was 10 to 12 pounds. But the thing is not to just lose weight for that little time frame, but just to overall develop healthier eating habits and just making an impact on your health by making healthy choices and just the teamwork. When you have other people participating with you or challenging you, it makes you that much more focused and intentional to try to lose the weight that you want to lose to reach your goal. Then our school health service updates. So school nurses provide ongoing education to parents about health processes and health updates throughout the school year. Some of the things we teach on is the medication administration during the day. A lot of parents have questions about the medication that they send to their school nurses, and they want to know just more. And some parents are not aware that we're able to give medications at school. We have students who are on an asthma action plan. Even though a lot of students have a doctor's note that says they can keep their inhalers with them, we still have them on an asthma action plan. So if anything happened, we know which students have their inhalers and which ones keep their inhalers in the nurse's office. We encourage our younger elementary students to keep their inhalers in the nurse's office, but sometimes parents even want them to have their inhalers with them, and we tell them for best practices they should keep their inhalers in the nurse's office. Then we have our seizure action plan for students who have seizures, and then we have EpiPens. Then immunization requirements is the ongoing thing that we are always constantly looking at students' immunizations and affidavits. And then during the fall, we also do a flu surveillance, and we keep the amount of students and staff who reports that they have flu, and we report that to the health department. So staffing and training, each campus have either an RN or LVN, and some of our campuses have both the RN and the LVN. During the beginning of the school year, the campus's nurses provide training to the staff, medical emergencies, what to do if there's not a nurse on campus. They do diabetes training because sometimes students, they get into diabetic situations in the classroom, and teachers need to know what to do if that happens, even though the nurse may be there, but they need to know how to act quickly if it's a seizure or even a student having an asthma attack. So we give that training to the teachers during the beginning of the year. We have CPR classes that are offered throughout the school year, and this year we had a total of 9 classes, although we had only 97 staff members that participated. But each year the number changes because we trained about 200 employees last year, so their certification is still good for this school year. So next school year, the numbers will increase. And to date, we've seen over 3,100 students in the office throughout the district. Last school year, we completed over 4,000 vision and hearing screenings and reported that to the state of Texas, and we screened 1,000 spinal screenings. And these screenings are important because if a student can't see or they can't hear, then it's hard for them to learn. And with the spinal screening, if we catch a curve in their back and their spine early enough, then a lot of times it can be corrected via surgery, sometimes exercise, just different things that the doctors will order. But early detection helps them to have a better outcome. So supporting student health, early detection, and readiness to learn across all grade levels. The nurses, I already went over this slide. They do the screenings for pre-K, kinder, 1st, 3rd, 5th, and 7th grade, and any new to district student, they come in and they get screened. During that screening, we also look for the type 2 diabetes by the markers and indicators on the back of their necks. And so when we find a student that may be potentially positive for type 2 diabetes, we send reports home to the parents, encouraging the parents to take those students to see their pediatrician, and then communicating with the parents and sometimes communicating with their pediatrician. We put in procedures and protocols that will help that student. And when a student failed their eye exam, we work with the low vision clinic in order to try to get those students a professional exam and the glasses that they may need. And as I said earlier, reviewing immunization records is an ongoing process. It's a lot during the beginning of the school year, but each month we're constantly reviewing immunization records. In this school year, we, through Parkland, we had 5 immunization clinics through Parkland that came to Duncanville, and they gave our students shots without their parents being present. At the beginning of this school year, there was like 987 students who was non-compliant with their vaccines. So as of today, we have 10 students that are delinquent. So we worked really, really hard in getting our immunizations in compliance, and we put in a lot of different protocols and safeguards to keep us from going back to that 987. It was hard work, but we did it. We made it to 10, and so we actually at one point we was at 0. And I have to do a shout out for the high school, because the high school, they had at one point they had the largest number. They are at 0, and that's commendable. In the past, we've had immunization audits like every year. This is the first year that we didn't get audited because of our immunization. So we plan on keeping that record and keep moving forward. And Parkland is going to continue to work with us, so I'm glad of that. So save the date. I don't know how many of you remember last school year in June, we had a community health fair. Well, because of the success of that community health fair, we're having another community health fair on August 1st. You all are invited to attend. The hours is from 9 a.m. to 12 noon, and it's going to be at Sandra Meadows. More information will be coming out, but I just wanted to share it with our school health advisory committee so that y'all can save the date and come out. There'll be different screenings going on, taking place. Parkland will be there, Methodist will be there. They're also planning on doing a food giveaway from North Texas Food Bank. So more information will be coming, but just mark your calendar and look forward to seeing you all. We're partnering with Children's on the Mend, and we're also doing this to increase our enrollment, to get our parents to enroll their children in school earlier than later. And when they come out, the students will be getting free backpacks. We're planning to try to have free haircuts and just make this a big event for Duncanville ISD. Do I have any questions on anything that I presented so far?
Because we were at 0 at one point regarding the immunizations, did you see a decrease in illnesses or diseases in the district this school year compared to last? Or did it happen?
So one thing I can say is for us this year, we didn't get a scare of measles like we did last year. Last year there was, I want to say, 2 reports. There was possibilities, and so we had to do the investigation and all of that. But this year we didn't encounter that. Childhood diseases, like I think this year we had only 1 report of a possible case of chickenpox. And when we look at our immunizations compliance rate versus our waiver rates, we're still over 80% of our students are getting vaccinated, and that 20%, probably about 15% of them, they are fully vaccinated. Parents usually opt out of their last vaccine, which is the Tdap and MCV4 in the 7th grade. So most of our kids are, even the ones that are on an affidavit, they still have vaccines. They got all their childhood vaccines, and those vaccines that prevent the diseases like polio and measles, chickenpox, they have those vaccines. We don't keep a record count on the amount of students that get the flu vaccines because it's not required, but our flu rate compared to other districts, the flu rate that was reported, it wasn't a large number of students that had the flu or that they reported having the flu. So thank you. Any more questions? All right. So now we will have Mr. Flint will come up and talk about middle school health curriculum.
Thank you, Ms. Grant. Hi, my name is Brian Flint. I'm Director of Teaching, Learning, and Advanced Academics, and I oversee curriculum pre-K through 12th grade, as well as the GT program and advanced placement. Today, we're here to talk about health and how we're going to be teaching health to our students. So currently in middle school, we offer it as an elective. Health is offered as an elective to our middle school students, but not all students have room in their schedule to take health, so not all middle school students are receiving instruction around the health standards. So that becomes an issue. Another issue is that they're taking an elective it's an elective that could be for high school credit, but we can't offer it because we don't have the sort of teacher certified to teach it at that level. So we're going to be looking at some proposals on what we're going to do with health. Now, we're looking at PE here because we're looking at combining PE and health. And here's how we're going to help them make this work. So students are required to complete 2 years of PE when they are in grades 6 through 8. And the requirement by the state is 225 minutes of PE every 2 weeks. But PE in Duncanville is scheduled for next year to be at 350 minutes every 2 weeks. So that leaves time to teach health standards while also making sure that we also meet our PE minutes too. So there's some extra minutes there where we're in PE where we can be teaching the health standards to our students. So one of the proposals that we're making is that we're going to have the health content be embedded inside of our PE courses. And that's going to make sure that all of our students get access and exposure to the health TEKS. And that will help us come into compliance with the state and what needs to happen, because the state wants all 6th graders to have that. And then 7th and 8th graders, we can split up the health TEKS there between those 2 grade levels during PE. So health is no longer going to be a standalone course in middle school. We're going to make sure to embed those health TEKS into the PE course. Now that's going to provide more space in student schedules for other electives too. And it will also expand access to fine arts, CTE, athletics, and other courses that align with high school and career pathways. So there's some benefits to us being able to do this. Again, the major one is making sure that we're in compliance and making sure all of our 6th, 7th, and 8th graders are getting exposure to our health standards. So what does that look like in terms of topics? Well, here's our 6th grade topics. I won't read all of these to you, but these are our 6th grade topics. And as I go to our 7th and 8th grade topics, you notice that they're very, very similar. Some of the things that are different is like substance use and abuse is very foundational and grade level appropriate for 6th grade, as well as human growth and development is just very introductory on how humans grow from childhood up to adulthood. And then same thing with some consumer health. The last one, health promotion and decision making, changes to health promotion and disease prevention in the upper grade levels. And when we're talking about disease prevention, it's like hygiene, washing your hands, vaccinations, how to prevent diseases from spreading. So we're going to be integrating these health TEKS into PE, and so this is our proposal. For the 26-27 school year, health TEKS will be incorporated into physical education classes to provide a more comprehensive approach to student wellness. PE students will continue to achieve the number of minutes required by TEA for physical activity, and physical education teachers will receive training to effectively incorporate health TEKS into daily instruction. So we'll have to help our PE teachers transition into this too, and we're also working with our athletic director to help with this. Who was that? Sorry.
I'm representing Mr. Mitchell today.
Oh, yes. Gotcha. Glad you're here. You doing okay, Ms. Butts?
It's nice to meet you in person.
Yeah, it's good to see you too. We usually are over Zoom or on the phone together. So teacher preparation and support. We want to make sure that we support our physical education teachers to receive health TEKS training and how to integrate that into daily lessons. Professional development will focus on lesson design, pacing, and student engagement, making sure that they know how to pace out those lessons, and we'll provide some pacing guides for them. And teachers will be supported in balancing health instruction with active participation. So they're going to be, still doing PE and getting their physical movement and learning how to do like different movements and do like the sports activities and learning some developmental things from PE. But we also want to make sure that they're getting those health TEKS too. So daily PE instruction will continue to include the required minutes for physical activity. So those will still meet those 225 minutes every 2 weeks. But the health TEKS will be incorporated within the class without reducing that student movement opportunities. They're still going to have movement opportunities daily. Instructional planning will ensure compliance while strengthening student learning. And that's the end of for the proposal there. That's it? Okay. Thank you.
Let's sit down. Do anyone have any questions over that?
I think one thing I just wanted to reiterate that Mr. Plant said is just that our goal is to really integrate PE and physical education as opposed to making them feel like two separate things. I don't wanna date myself, but I'm like from that age where it's like, get your health book out, it's like, it's time for health, but really helping teachers understand that they need to be integrated. And so that will definitely be our focus in the professional development, in August, equipping teachers, our PE teachers, and helping them understand how to do that, because they're gonna need some training, as Mr. Flint mentioned.
Great, thank you.
Thank you, Ms. Grant.
So as I stated earlier, Project Code Red, Kelsey nor Leslie was able to be here today, but they did send their presentation. And they wanted to give updates. If you all was here on our very first SHAC meeting, they talked about Project Code Red. So from December to April, let's see what has taken place. A summary of their last presentation, what is Code Red. It's a student-led initiative dedicated to ensure menstrual equity in Duncanville, so that any student that needs menstruation products, they can get them, and not just get maybe one or two, but they can get what they need for the length of time that they're on their cycle. We put in little red baskets throughout the school. School health services have been supporting them, and then they did different fundraisers to also support and raise funds to get the personal hygiene items. So since our last meeting, donating period care packages to the Panther Pantry. I want to say that Project Code Red donated supplies to the Panther Pantry, and then the Panther Pantry also gets donations for menstrual supplies, because sometimes parents are just not able to buy those things that girls need. They established a formal leadership structure and submitted official documentation for recognition as a Duncanville organization. The high school is behind them and supporting them with their initiative. And so the goal for them is, they started with the high school, but they want to take it to the middle schools and then eventually into our elementary campuses. They collaborated with other school organizations to raise awareness and engage in community service initiatives. I know they did different fundraisers, like they had a skating event to raise money for it, and then they sometimes would go in the cafeteria for awareness for their Project Code Red. The priorities for next year: community service initiative, implement monthly donations to the Panther Pantry to ensure consistent access to supplies for the broader community. So they're not just doing it for the school district, they're doing it for our community as well. Additionally, encourage member participation in service projects focused on menstrual equity to increase awareness and advocacy. Expanding fundraisers and donation drives with official recognition as Duncanville organization. They will resume hosting fundraising events. And like I said, they did the fundraisers during the school year, but I think their goal for next year is to do even more fundraisers and to get the awareness out for more people to know about Project Code Red. Their long-term goal, number 3, is sustainability. To build long-term sustainability, they will actively recruit underclassmen through events such as freshman orientation, Champion's Choice, and outreach to the local middle schools. So they're really trying hard to get other participations from other students involved. This year was really Leslie and Kelsey. And Kelsey is graduating this year, but she's passing the baton to Leslie, and she's still gonna work with Leslie, but the goal is, just because both of them are upperclassmen, Kelsey is graduating, they don't want this to die down, and I don't want to see it die down, because I know how students will come in and sometimes they're embarrassed to tell you that they need more than 1 or 2 items. With the Project Code Red, they can just go to where we're housing them and get what they need for that duration of that time. So to decrease the embarrassment around that monthly. Proposal revision and district collaboration. We will revise our previous proposal to better align with the district's financial landscape, working alongside district officials to develop a more feasible and mutually beneficial plan. And thank you. We're sincerely sorry we weren't able to attend this meeting in person. However, we'd like to thank everyone who believes in us and has contributed to Code Red this year. Best regards, and they left their contact information. And so they did a great job this year, and this was their first year doing the Project Code Red, and they put their heart in it. So we're going to continue to support them throughout the school year and get the donations that they need. And like I said, eventually it will be in our middle schools and then in our elementary campuses. So any questions on that?
How does that work, like, when you have the items like in the red basket? Did you notice that students would just take things, or would they literally just take what they needed?
Both. But we also support them through the nurse's office. So I gave the nurse's office some of those items and let them know, hey, if they need however many they need for their time, just go ahead and give it to them. So it's working. It's a work in progress, because one of the things that we want to eventually do is put the vending machines in, but then we think about, well, they'll be free, but we don't want them vandalized. We don't want to put them up and then kids start, taking them down, or just, children, our young people. Yes, yes. But any other questions?
Will they be there on August 1st?
I can invite them. I'll put that on our team committee agenda and see if we can get them invited. And again, this is our last meeting, but we still need parents, we still need students. So although this is our last meeting, my contact information has not changed. If you know of any students that may want to serve on the School Health Advisory Committee, tell them about Shaq, give them my email address, and we'll reach out to them. If you know of any parents that may want to serve on the committee, we have president and vice president positions that'll be open for next school year that we'll be voting on, because our current president, it's hard to believe that she served 2 years. Although she says she don't mind serving, we do have to open up the vote to see if we can get someone new. So that's the end of our committee, our meeting. Thank you all for coming. If you didn't sign in, please sign in. If you haven't gotten a cake, a bundt cake, or some refreshments, please get the refreshments. Please get the bundt cakes, because they're for you, to tell you thank you for just coming out and supporting us during our School Health Advisory Committee. So thank you all again. All right, you're dismissed.